Hello, everyone. Welcome to Stanford CARE's monthly community health talk series. My name is Robert Huang, and I'm a gastroenterologist and a cancer epidemiologist at Stanford University. I'm pleased to bring you this series of talks co-sponsored by Stanford Health Library and the Vincent V.C. Wu Memorial Foundation. I am very pleased to welcome Dr. Howard Koh, who will speak on health equity and leadership for AANHPI populations, personal and professional perspectives. Achieving health equity is a compelling vision for our diverse nation, but it requires a clear understanding of health outcomes for all major American populations and their subgroups. In the case of Asian Americans, Native Hawaiians, and Pacific Islanders, AANHPIs, the fastest growing racial ethnic group in the United States, fundamental data challenges have hindered progress. However, over the last decade, there have been some notable advancements. Dr. Koh will delve into the complexities of AANHPI health disparities and explore the strides made in achieving health equity. AANHPI communities encompass more than 50 different ethnicities, 100 languages, and span from the U.S. territories in the Pacific to New England. Understanding the heterogeneity within this population is crucial for documenting health outcomes, both overall and by subgroup, and comparing them with those of non-Hispanic whites and other populations. Dr. Howard Koh is the Harvey V. Feinberg Professor of the Practice of Public Health Leadership at the Harvard T.H. Chan School of Public Health. He previously served as the 14th Assistant Secretary for Health for the U.S. Department of Health and Human Services, after being nominated by President Barack Obama, and previously served as Commissioner of Public Health for the Commonwealth of Massachusetts after being appointed by Governor William Weld. A graduate of Yale College and the Yale University School of Medicine, he trained at Boston City Hospital and Massachusetts General Hospital, earned board certifications in 4 medical fields, has been principal investigator of research grants totaling $27 million, has published more than 300 articles in the medical and public health literature, has received over 70 awards, including 6 honorary doctoral degrees. Please join me in welcoming Dr. Howard Koh. Dr. Koh.
Thank you so much, Dr. Huang, and welcome everybody. It's such a great honor to be before this distinguished audience. And I want to thank Stanford CARE and the Stanford Health Library and the Vincent Wu Foundation for sponsoring this presentation today. It's my great pleasure to talk about health equity and also offer some perspectives on leadership for the Asian American, Native Hawaiian, Pacific Islander populations, AANHPI populations. This is an area that has been important to me my whole life, and it's very personal to me. So I'm going to make this a very personal perspective as well as a professional perspective. And it's going to be a broad overview on some of the health equity issues facing our community today. And then I look forward to your questions, and thank you so much for your hospitality. Next slide. First, I want to say that it was about 4 or 5 years ago that I got to see the vibrant nature of Stanford CARE when Dr. Rob Huang and Dr. Juha Huang and other colleagues invited me out to speak, and I got to see your vital community in action. So I feel like an honorary member of your community, and I followed very closely what Stanford is doing with respect to AANHPI health. So thank you for having me here today. Next slide. So if you ask, what's the status of the AANHPI population in the United States right now, I would say we're still in a very uncertain time. On one hand, we get celebrated in the news for contributing to the social fabric of our society. So here's one major example through the Olympics and other athletic contests. You often see headlines celebrating American excellence in terms of skating and snowboarding and figure skating. And we are held up as leaders for American society. It is also even notable in a humorous example of advancement that Ji Young, the first Asian and Korean American Muppet, was introduced on Sesame Street a couple of years ago. So we could say, well, in general, our community is making progress in terms of being recognized as being a very important part of the social fabric. Next slide. But as you know, we are still in a very difficult time with respect to the aftermath of COVID and the associated hate incidents that have been well documented over the last number of years. The shootings, the number of hate incidents being tracked by our colleagues at UC San Francisco, Stop AAPI Hate. We know those incidents have reached high numbers, and we know, unfortunately, they're driven by hate directed against the ethnicities represented by our group, because violence is accompanied by cries of, you brought the virus here, or go back to where you came from. I know all of us in the AANHPI community are familiar with hearing that. I know whenever I heard that when I was a kid, especially, I would think, what does that really mean? What if you came from the United States of America? So that's the quandary we're in. And despite the fact that our community contributes so much to the social fabric of our country, we're often viewed as foreigners in our own society. And then when you look at polls and surveys taken through COVID of all Asian Americans, whether they were directly subjected to violence and racism through COVID-19 or not, more than half feel that their mental health was affected by reports of discrimination and violence. Over half reported feeling unsafe in public because of their race and ethnicity. I got to contribute to an analysis of about 12 nationally representative polls. Over on the right, you see the reference from Health Affairs Forefront last year with my colleague Mary Findling as the first author. And so I have written about this in journals like JAMA, and here's a reference on the bottom about healing and health equity for our population, where I write this viewpoint along with my dear colleagues, Julia Choi and Jeff Caballero. Next slide. So this is all very personal for us, and let me just start and share some of my personal story. I'm here because of the sacrifice of my parents, Dr. Kwang Lim Ko and Dr. Haesung Chun Ko. Over on the left is a picture of them as a young couple who met in this country and married and stayed here searching for the American dream. I lost my dad over 35 years ago, still miss him every day. But on the bottom left is a picture of my mom, who's 94 years young. And I'm very happy and proud of her, first of all, because she's been such a pioneer for US-Korea relations. But she has also been here long enough and lived long enough to see the results of her sacrifice. And I'll be saying more about some other members of my family in just a second. But over on the right is my family, and I'm so proud of them. My wife, Dr. Claudia Arig, who's an ophthalmologist. My son, Steve, who's to my immediate left, who's an associate law professor at Boston University. My son, Dan, on the right, who's the deputy cabinet secretary in the White House for President Biden. And over on the extreme left, my daughter, Katie, Dr. Katie Ko, who's a Harvard-trained psychiatrist and a street psychiatrist for Boston Healthcare for the homeless. I tell audiences that when you grow up in an immigrant family, you don't take this country for granted. You don't take rights and freedom for granted. And I know I learned from my parents from the time I was a very young child, there was meaning and purpose to our journey in this country, and we were supposed to get the best education possible and then grow up and do something to help serve society. And we've tried to pass that on to our own kids, my wife and I, and we're very proud of them. And I know if I got to talk to each and every one of you, you would have this story about your family and your goals and hopes for being in this country and making a contribution to your community as well. Next slide. And my dad had this wonderful saying, which I repeat often in talks like this, to be broad like the sky. He would often point out that oftentimes in society and in education and academia, there's a push for you to get more and more narrow in your focus in life. But he encouraged us kids, and in fact everyone, to keep our vision broad for the future. So I think about this saying a lot as I go about my daily life. It has inspired me and made me think about the big picture, and actually was a factor in me going into public health after starting my career in clinical medicine. Next slide. So I just want to review, this may sound very basic, but when we talk about health, I think about two major statements from the World Health Organization 70 years ago. Next slide. First, it states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So this is a very broad definition, and it's really critical to think of health this broadly, not just physical well-being, not just mental well-being, but also social, and if I can say spiritual well-being as well. And then the WHO Constitution in the 1940s wrote, the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. If you come to visit us at our school at the Harvard Chan School of Public Health in Boston, this saying is engraved in concrete in 7 languages on the front of our so-called FXB Human Rights building. So helping all people reach the highest attainable standard of health is a public health goal that we all share, and a goal for sessions like tonight. Next slide. So again, to make this very personal, when I started my career as a physician, and particularly an oncologist and a cancer specialist, I started looking at graphs like this, asking, what are the leading causes of death in men and women in our society? And you see these trends over the last century or so that describe trends in prostate cancer, colorectal, stomach, other important cancers. But there's one important cancer that stands out, of course. We hit the next button. And that's lung cancer, of course, driven to such a large degree by tobacco addiction. Next slide. So as a young physician, I got drawn into public health because I saw that if I was going to make a difference in the area I trained in cancer, that I had to make some contribution in tobacco control. And at that time, now this is several decades ago, our state was involved in raising the tobacco tax through a ballot initiative, and people of Massachusetts were asked to come to the polls and vote yes or no for an added 25-cent tax increase per pack of cigarettes. And the agreement was that if it passed, the millions of dollars generated would go into state coffers for public health and tobacco control in particular. So it passed in 1992 and made history. Actually, it's appropriate I'm talking to the California audience because California was the first state ever to do this in 1988. So we were the second state. And so public health history and tobacco control history was made then. Over on the right, I'll never forget the leadership of Dr. Blake Cady and Candace Pierce of the American Cancer Society. I got involved in all of this as a young volunteer, and this also changed my life because it made me see the power of public health and politics, in this case, in beating back the tobacco industry in Massachusetts. It was that visibility, actually, that led then Governor William Weld to appoint me as Commissioner of Public Health in 1997. Next slide. And so I went from being a young physician trained in the clinical setting only to becoming a public health professional, first at the state level, and then later from 2009 to 2014 at the federal level. Next slide. And I joined the Obama administration and was sworn in as Assistant Secretary for Health. Got to support the president and then Vice President, now President Biden, of course. Worked with my colleague, Dr. Fauci, back then on H1N1, the last pandemic. And of course, we have admired his leadership through COVID. And then on the bottom left is a picture that's very important for my family because in the fall of 2009, then President Obama asked his top AANHPI appointees to stand behind him as he signed this executive order reinvigorating the White House initiative on Asian Americans and Pacific Islanders. So standing behind the president wearing a blue tie is me, as you can see. And standing to my immediate left in this picture is my brother, Harold Coe. He's in the pink tie. Harold at the time was the top lawyer in the State Department under Secretary Clinton. So needless to say, my mother loves this picture. Next slide. So through this whole run, as a young kid growing up, as a medical student, as a physician, and then as a public official, I've thought a lot about what it is to be part of the AANHPI community, what it is to be a son of an immigrant family, and look for data and understanding about our population. But as you know, we're often invisible or misunderstood. We are certainly profoundly heterogeneous. Too often we're still treated as outsiders, as them rather than us, and as foreigners in our own country. And we are so heterogeneous, I often point out that the term Asian American is as useful as the term European American. And we have many ethnicities, many languages spoken, as Dr. Huang mentioned as he introduced me. About close to 60% are foreign born. We have some subpopulations of our community less than proficient in English. And a major challenge for all of us has been that data, good data for AANHPI populations has long been incomplete, misclassified, aggregated, or just simply absent. And when you can't find data, you just assume that there's no problem and no disparity, when of course the exact opposite is true. So over the years, many of us in the academic community, particularly at Stanford and elsewhere, have just kept sounding the urgency for more accurate, disaggregated data for our populations. And I'm going to be saying more about that through this presentation. It is a theme that was evident to me when I was a young medical student looking for information on AANHPI health. It was important to me as the first Asian American Commissioner of Public Health in Massachusetts. And I thought a lot about this and worked on this as the Assistant Secretary with some outcomes that I'm very proud to report in some slides coming up. Next slide. So you all know that we are the fastest growing minority group in the country, some 23 million of us right now. We are projected to surpass some 46 million by 2060. We have the 6 groups that have population over 1 million in our country: Chinese, Indian, Filipino, Vietnamese, Korean, and Japanese American. Next slide. And I like this graphic that shows how heterogeneous we are by educational attainment on the x-axis and on median household income on the y-axis. So you see, for example, on the top right, Indian American subpopulations generally rank high according to those 2 criteria. Where over on the bottom left, we have subgroups like the Samoan or Laotian or Native Hawaiian groups that rank low according to these 2 criteria. So the heterogeneity of our group is something that we have to be very aware of. I'm sure you think a lot about this at Stanford. Next slide. And the Native Hawaiian Pacific Islander populations deserve a lot of attention as well. I know I was sensitized to this because when I was Assistant Secretary, on my way back from an international conference in Singapore, I visited Micronesia and stopped in Chuuk, Micronesia. On the right, you see pictures of me touring the island with the then US ambassador to Micronesia. And on the very bottom, the ambassador and I are standing for what looks like a bookcase, but it's actually a walk-in clinic. And we were standing in front of the pharmacy there. And the whole facility had a couple cots there, and I'm posing there with the healthcare professionals who were staffing that clinic. So I'll never forget how brave those health professionals were, how isolated this island was, how much need there was, but it was all part of the AANHPI experience. And of course, with the fire in Maui that just recently occurred, this has gotten so much attention to the suffering of the people of Hawaii through that tragedy. Next slide. So one major achievement in terms of data collection came through the Affordable Care Act, which of course was started in 2010, a major achievement of the Obama administration. And Section 4302 updated data collection standards for all HHS-sponsored health surveys involving self-reported information to include additional detail for race, ethnicity, and also sex, primary language, and disability status. And I was ecstatic to see this and helped coordinate HHS-wide efforts to update this data standards. We also published on this, as you see in this publication on the bottom left, which was led by my colleague, Dr. Rashida Dorsey. But over on the right, you can see that before this passed, you would answer surveys and it would ask, what is your race? Usually the options were white, Black, American Indian, or Asian, or rather Alaska Native, or other. You know, many of us have spent our lives in the other category. But here, because of Section 4302 of the ACA, there were multiple options for the Asian American population, Asian Indian, Chinese, Filipino, Japanese, Korean, Vietnamese, and also for the Native Hawaiian or Pacific Islander population, Native Hawaiian, Guamanian or Chamorro, Samoan, or other Pacific Islander. So this was an opportunity to gather accurate, disaggregated data. And I think over time, we are seeing more and more publications showing the result of the precision of getting information when it's disaggregated because of methods like this. Next slide. And so here in 2023, we see the current status of Medicaid expansion as a result of the Affordable Care Act. And you know that over 30 million Americans have now gained access to care because of the Affordable Care Act. So it's a great honor to be part of that. As the Assistant Secretary for Health, I helped implement the ACA along with so many in my department and then thousands across the country. And with respect to AANHPI populations, the advocates did heroic work trying to sign up people into health plans and into Medicaid. Oftentimes we heard the criticism, oh, this is too hard, and this population is too heterogeneous, and you have to employ people who are comfortable with outreach in so many different languages. Are we really going to make an impact? So we try to track not only health insurance coverage uptake, but also whether we're reducing disparities in health insurance coverage. Next slide. And so getting that data was and remains very, very important. Also, in terms of getting dedicated data for our population, you may probably know, the researchers in the audience, that there's something called the NHANES study, which is a time-honored way of getting data about the American people through these trailers. And I'm posing here before a team involved in the NHANES survey. And this involves personal interviews, standardized physical examinations, even laboratory measurements. And in 2011, NHANES began oversampling Asian Americans for the first time ever. On the bottom right, you see me posing with a Commission Corps officer, where if you go into this trailer, they'll ask about dietary intake and put you through some simulation models. And this led to articles like you see in the bottom left, overview of Asian American data collection, release, and analysis from NHANES 2011 to 2018. So these are articles for the first time that start showing dedicated health information related to the AANHPI population. So if I can say, as the Assistant Secretary during that time, and now as a professor, it's been very gratifying to see this improvement over the years. Next slide. So back to the ACA, I'll never forget, after I left government, I came back to Harvard, and I was looking at disparities of health insurance coverage pre and post ACA. And you would see data like this. In gray is the pre-ACA rates for whites, blacks, and Hispanic Americans. The good news is that the uninsured numbers dropped for all three categories. But the research assistant I had, who was at the time a public health student at Harvard, a physician of Asian heritage, came to me and said, Dr. Ko, there's been no analysis of the impact of the ACA on AANHPI populations. I said, what, are you sure? Can that be right? I mean, this has been now a number of years since the ACA had passed. And so his assessment was accurate. We looked closely, so we decided to do something about this. And this student of mine, Dr. John Park, led a couple analyses. I served as senior author, and I was able to bring in some wonderful colleagues who are so well known in this area. Doctors Ben Summers, Arnie Epstein, Graham Colditz, Sarah Humble. And what we did was to fill in information about how these rates were changed for the AANHPI population for the first time. So there it is. And there you see that, to our delight, there was substantial improvement for lowering the rates of uninsured for AANHPI population. And next slide. And if you look closely, as of 2016, the uninsured rates for whites and the AANHPI population were essentially the same. But before the ACA, the AANHPI population had higher numbers of uninsured, but now that disparity had closed. So that was pretty big news, and we published this in both Health Affairs and JAMA Internal Medicine. Now, the major caveat was that was 7 years ago. I'm not sure I've seen peer-reviewed data to update these trends. We hope it has continued on, but this is one example of how disparities can be closed. And I think the credit goes to the tremendous advocates across the country who did outreach in multiple languages and with navigators and assisters, and just did not give up. And I just want to credit them as I show these results. Next slide. And then, because we wanted to demonstrate that this affected every major subgroup, we looked into those trends, and sure enough, here you see how the rates of insured increased for Japanese Americans, Asian, Indian, Filipino, Chinese, Vietnamese, Korean, and other Asian. And so it's been very, very gratifying to see results like this. We published this in the Academy of Health blog in 2018. And again, we hope these trends have continued. We need more current data now that it's 2023, but we're very proud of the impact of the ACA for many reasons, but one is to decrease disparities and actually eliminate this disparity as of 2016 between whites and the AANHPI population. Next slide. And then I've had the honor of being involved in a number of other national efforts for AANHPI health. When I came to Washington and became the assistant secretary, I was very aware that I was the first Asian American assistant secretary for health ever. So I wanted to do whatever I could to help my community. And it was brought to my attention that chronic hepatitis, especially Hep B, obviously is disproportionately higher for the AANHPI population than for non-Hispanic whites. There wasn't a national strategy really for either Hep B or Hep C at the time. And you see here some basic facts that half of the US Hep B burden occurs among AAPIs. 1 in 12 are infected, and far less than 50% of those chronically infected with Hep B are even aware of their serostatus. A lot of this work, pioneering work, was done by my colleague, Dr. Sam So of Stanford. So he chaired a National Academy of Medicine committee on addressing chronic hepatitis as a major public health challenge. And then he came to us at HHS and said, can we work together so that your department puts this into action? And I want to thank my dear colleagues, Drs. Ron Baldessari and John Ward, who were then at HHS and CDC at the time, my senior advisor at the time, Rosie Henson. And we started this National Viral Hepatitis Action Plan, established a special unit at HHS, And that's ongoing up through the current time and going forward. And just this past summer in JAMA, Drs. Valdesari, Ward, and I wrote an update to progress on the plan, talking about the need to continue to overcome health inequities, even though tremendous progress has been made in terms of screening recommendations and especially treatment for Hep C too. Next slide. Now, I have many memories of special outreach for the AANHPI populations for Hep B, posters in multiple languages. So here's one example of me doing outreach in both English and multiple Asian languages. I always chuckle when I see this because, you know, when you do public health, you use every part of who you are to send a message of public health and health promotion. And as you see below, the ACIP now recommends that all adults ages 19 to 59 should receive hepatitis B vaccines. So this is real advancement for hepatitis B nationwide. So many advocates been involved in this, so many from the Asian American, Native Hawaiian, Pacific Islander community. Special thanks again to Dr. So, who taught me a lot and has served as a role model for all of us at Stanford and beyond. Next slide. And then at Stanford, I got to first meet Dr. Juha Huang and Dr. Rob Huang, and they educated me about the public health challenges for gastric cancer for the AANHPI population. As you can see, the crude incidence for various age groups by Korean Americans, Japanese Americans, and other groups. Juha and Rob made me aware that screening efforts have been pretty active in Korea and Japan and elsewhere for quite a while. And don't we need similar type attention for these subpopulations in the US? And so there have been really heroic efforts by the GI leaders at Stanford and beyond, some wonderful, fascinating conferences that I've been very honored to attend and try to add some policy perspectives here. Attempts to put this before the U.S. Preventive Services Task Force to see if they would weigh in on the advisability of screening and prevention for gastric cancer. So that work is ongoing, and I just want to, again, thank the Stanford community for their leadership in this. It's very exciting to see attention paid. Now, progress in public health policy is very, very slow. So this is going to continue to require a lot of patience. But when you see crude incidence trends like this, you can see why leaders like Juha and Rob and others have decided that this is worth tackling on behalf of public health. Next slide. This is like the COVID era, and here we are as 2023 is ending with 1.1 million Americans who have died from COVID-19. So again, as this pandemic started, I looked for data for AANHPI, and particularly disaggregated data, still hard to find. Very frustrating, and not that many publications, at least initially. Hard to get a definitive idea of how this is affecting our community right now. Over on the right, here's some updated data. I think this is from Kaiser, suggesting that the AANHPI population has not suffered as high rates of infection, hospitalization, or deaths compared to other major ethnic groups in the US. But we always have to check and see how good the data is supporting this. On the bottom, it looks like from the data I've seen that the vaccination rates among the AANHPI population have been generally pretty good. So let's see if that holds up over time. I know initially there was a lot of concern about challenges with vaccine hesitancy and trust in the system. It could be that over time, we have seen this play out so that vaccination rates are doing very, very well. But let's see if we can see more publications on this coming forward and more definitive answers about how our community is doing through COVID. Next slide. And then, of course, it's worth pointing to other major health disparities. Mental health for youth and adults. All the Asian hate issues have exacerbated this crisis, and I've already pointed out to that in my opening comments. Diabetes is another one. And it's been documented that Asian Americans have higher prevalence of type 2 diabetes at relatively low BMI cut points. So there have been efforts to screen at 23. It's a logo from the American Diabetes Association. And then I've already mentioned my personal and professional commitment to tobacco control. This is an issue, of course, that is very challenging in Asia, particularly among men. And so I've witnessed how this has affected members of my own family. And it's just terrible to see the uptake of tobacco dependence for certain populations. Asian American immigrant men without a college degree who have resided in the US for at least 10 years, some data show that the prevalence of tobacco use could be as high as 23%. Yeah, even though the overall rate in the United States is about 11% or so. Next slide. So again, this is an area that I've been doing outreach on ever since I was a state health commissioner. Here they pictured me back then saying in my best Korean, "Tambadol gunupshida," let's quit tobacco. But they would put me out on other posters. Next slide. In multiple other languages that I can't speak. On top of a temple here over on the right. So you can look at this, and again, you know, the message is that when you do public health, you try to use every part of who you are to send a message of health promotion and disease prevention. Next slide. So what are the challenges for our community in terms of leadership now? Because, you know, our population is growing in the country. I'll show you some slides. Actually, here they are. Right now, the AANHPI comprise about 20% of physicians in the U.S., almost a quarter of medical school enrollees. So that's astonishing. But the NIH research budget dedicated to AANHPI health needs has barely increased over the last 20 years. And when you look at medical research studies in 2021, 2022, 23, at this point, we should always see data relevant to the AANHPI population and not always have us in the other category. But that's still not the case. This one meta-analysis in 2021 showed that only about a quarter of studies had data for the AANHPI population, and very few broke those down into subgroups. So we need to have progress. We need to have more leaders in our community. Overall, on the right, I point to some colleagues of mine who have reached leadership positions. I'm very proud to mention them. Dr. Karen Kim is a physician who was named as the new dean of Penn State College of Medicine. I believe the first Asian American woman dean of a U.S. medical school. So we're very proud of Karen. At my school, the Harvard Chan School of Public Health, we have an interim dean, Jane Kim, who's a fellow Korean American. So we're very proud of her. You know, we want to send the message that members of our community can be healthcare professionals, can be physicians, can be nurses, can be leaders in all those fields, but also serve at the highest level in terms of hospital leadership, medical school leadership. But we're not seeing the numbers yet. So we got to keep encouraging one another. And the NHPI medical students are the least represented of all. So we got to track these trends going forward. Next slide. So how do we improve equity and inclusion for AANHPI patients and practitioners in academic medicine? Lots of discussion these days about having more diverse and inclusive health organizations. Everybody is a person who has blind spots, and we all have to be humble about that and be aware of our own blind spots as we try to be the best leaders we can. We have to be very sensitive to the AANHPI hate issues, which are still out there. And then also push for more research studies that report outcomes relevant to our community, particularly with the best disaggregated data possible. Next slide. If I had to summarize the simple message for this audience and for every audience when we talk about AANHPI health is avoid assumptions. I don't know about you, but as an Asian American, I've had so many examples of people assuming certain things about who I am. And people will make assumptions about your race and ethnicity, your birthplace, your first language, your socioeconomic status, your spouse or partner, your sexual orientation, your worldview. And, when this spills over, especially into patient care, it can be quite harmful. And so one basic message I often send in talks like this is when you have an AANHPI patient, don't assume, ask, and then listen respectfully. And if we do that, we can improve patient care, offer better person-centered care, try to move more and more people toward the highest attainable standard of health. These are issues that I often join with colleagues like Karen Kim, who I've already mentioned, Dr. Holly Humphrey from the Macy Foundation. This is a picture of Dr. Winston Wong, who is a big champion for AANHPI physicians. So these are themes that we talk about a lot. Next slide. And then there remains national coordination of these efforts. People may not know that in 1999, President Clinton established the White House Initiative on Asian Americans and Pacific Islanders. And that initiative has carried through successive presidential administrations. On the bottom left is a picture of when President Obama visited a meeting of the White House Initiative on Asian Americans and Pacific Islanders. And I happen to be sitting in that meeting. You might be able to see me there in the background. So that was quite an amazing moment. But on the bottom right, you see where President Biden has re-energized this initiative by signing the COVID Hate Crimes Act, reauthorizing the initiative, and pushing for goals for the White House initiative to respond to anti-Asian bias and violence, to really push for more disaggregated data, and to expand language access programs across all federal government, particularly since our population is so heterogeneous. Behind the president here in this picture are leaders that hopefully we all recognize and support. The vice president, of course, Congresswoman Judy Chu from California. I've known Judy for a long time, tremendous leader for our community. Congresswoman Grace Meng from New York, Senator Hirano from Hawaii. Seated is Senator Duckworth from Illinois, of course. So we're very lucky to have these leaders in Congress pushing for our community, and hopefully we can support them as we try to make progress for public health. Next slide. And then I really want to single out these national groups. The Asian and Pacific Islander American Health Forum, led by my dear colleague Juliet Choi. She's the president and CEO. The Association of Asian Pacific Community Health Organizations, APCHO, Jeff Caballero, who's been in service in that capacity for a long time. Jeff is so dedicated to the community. The National Council of Asian Pacific Islander Physicians, Winston Wong, I already mentioned him. Dr. Humphrey of the Josiah Macy Foundation. I happen to serve on her board. Next slide. And as I end, I just want to comment briefly on leadership, because many of us think, oh, well, we don't see many people in leadership who are of an Asian American, Native Hawaiian, Pacific Islander background. But when you've had life experiences like I have, you say to yourself, okay, here's my opportunity to make a contribution, even though there are no obvious role models to follow. And we have to learn from leaders around us that leadership is a choice, not a position. We have to help influence others by unleashing their power and potential to impact the greater good. Leadership is the art of mobilizing others to want to struggle for shared aspirations. That's classic definitions from Kuznis and Posner. And if you want to do leadership work, this is tough work. It's very lonely. This fascinating quote from Mary Lou Anderson. Leaders are called to stand in that lonely place between the no longer and the not yet. They're called to stand in that lonely place between the no longer and the not yet. I think of that often, especially as I teach my students, that if you're a leader that's going to be remembered, you have to take a risk and stand in that lonely place. Hopefully we can do this on behalf of our community more and more going forward. Next slide. And how do you best do this? You understand why you started on this journey. That has to do with one's meaning and purpose. I think it's a very spiritual theme. As you introduce yourself to one another, can you talk about why you're committed to addressing health disparities or promoting health equity or serving the AANHPI community, making it very personal so you can connect with others, and then making it unique so that people will remember you. I learned a lot about this through trial and error through my own journey, if I can say, but I'm trying to teach this to others now that I'm a senior professor at the Harvard School of Public Health. Next slide. We need to emphasize that this is not just about strategy and head and action and hands, but just as importantly, narrative and heart, addressing the why and the motivation in a very personal and profound way. Next slide. And when I give this talk, especially the students, oftentimes I'll hear, oh, well, this sounds interesting. You know, I have a lot of concerns, but I don't really have much influence. My circle of influence is very small. You know, I don't have any power. I don't have a fancy position. I don't have any money. What should I do? And if you read the famous book by Steve Covey, a leadership guru who published this nationally best-selling book, The 7 Habits of Highly Effective People, he would write that you should focus on your circle of influence. And when you do, it'll grow. And people will notice and they'll give you more responsibilities, and your circle influence will grow again. And that's how leaders get fostered and supported. So I've always been fascinated by that graphic, and I show that to you here. Next slide. And then as I end, I think the one of the best quotes I've ever heard for interacting with people, with building partnerships, is from Maya Angelou. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. To be an effective leader, you have to be so aware of this literally in every interaction you have with people day in and day out. If you can do this well and make people feel respected and supported, that's your way of building your community, building your networks, and helping you reach your highest potential as a leader, particularly in the field of public health. Next slide. So I'm hoping that with all these examples from the world of health disparities and health equity, you can take some lessons away for yourself to help all people in the AANHPI community and well beyond to enjoy the highest attainable standard of health. And if you do, you're making a contribution to public health that we all respect and admire so much. So thank you again for having me here at Stanford, and I appreciate your time and attention.
So thank you for an insightful, an informative, and an inspiring talk. And also thank you for all the work that you've done for the AANHPI community, including your work on hepatitis B, your work on data disaggregation, and your work in promoting Asians in leadership. I'd like to let the audience know that we are open for questions. So if you would please type in your questions in the chat. I know that we've gotten numerous questions already. And Howard, I could ask questions for the next hour, but I want to be respectful to our audience and let our audience members ask a couple of questions. So we already have a docket here of 4 or 5 questions. So I'm just going to start picking from the top here. Okay. So what are the most significant social determinants of health for AANHPI populations? And what social determinants of health are important but often neglected?
Okay, that's a huge question. And, you know, I think everybody is thinking about social determinants right now because we understand that it's much more than simple biology that affects whether you have any chance of reaching your highest attainable standard of health or not. Some of the basic ones that apply to all people have to do with housing security and food security. I think I mentioned at the beginning, or maybe I didn't, that health and homelessness is now a major priority that I'm working on.
Mhm.
All that work is inspired by my daughter, Dr. Katie Coe, who, as I mentioned, is a street psychiatrist for the homeless. And when you think about the affordable housing crisis in our country and the very visible homelessness crisis in our country, and that affects people of color disproportionately, that's something we should pay attention to. On the flip side, one very powerful social group are people who are faith leaders. I think not enough attention has been paid to that. And that theme might apply very well for the AANHPI community. Oftentimes, members of our community are strong people of faith, and it gets through hardships, and it supports them in their ups and downs of life. So when I hear a question like that, those are some of the social determinants I think of.
Another question we have is concerning innovations in digital health. So what are some innovations in digital health that you've seen that are advancing health outcomes positively for AANHPI populations?
This is a time where so much attention to digital health and social media through COVID. And I would like to think that if we do this well through digital health and other innovations, that we can try to improve trust in preventive measures like vaccine, even though we're all facing challenges with misinformation and disinformation. Mm-hmm. Actually, Bob, I chaired a National Academy of Medicine committee on rebuilding trust and tackling the infodemic through the pandemic era. And so this is a challenge for all of us. And I think social media and digital health can be a double-edged sword here. We often talk about the negatives, but I also think it can be used for good. So I would love to see more attention to that, because the misinformation, disinformation challenges out there, and we have to be all involved in that for all communities.
Mm-hmm. We have a question about stigmas. So the question reads, do stigmas within AANHPI culture influence health disparities? And I would like to add on to this question. You know, I've participated in many of these Asian health panels over the last year or two, and it seems that this a question that I get asked a lot, which I can't really answer, is specifically regarding mental health, stigmas around mental health and being Asian. I'm wondering if you have any insight into that question.
Yeah, so lots of ways to answer that. First, it's been well documented that of all groups who should be seeking treatment and care for mental health challenges, for whatever reason, the AANHPI community ranks near the bottom at seeking treatment and help. And I think that's a result of stigma in our community, oftentimes from the immigrant community, where you're not supposed to talk about these issues, and people aren't forward and open about needing care and needing help in the way they could and should. I think we are seeing progress here, but not enough. So hopefully we have more and more professionals who are sensitive to these issues. We can encourage our colleagues in the community to seek care and help if they have mental health challenges. And then I think overall the stigma themes, again, I think come up because the fundamental point I made in my talk is that too often you see a person of AANHPI background, and you make all kinds of assumptions about who they are and what their worldview is and what their cultural views are and whether they can speak certain languages or not. And we have to just treat each other as human beings and as fellow members of the AANHPI community. And if you don't know, ask, but withhold judgment and don't make any assumptions. We also need to make sure that those assumptions don't spill over into healthcare if you're a physician or health professional taking care of somebody, because that's not what person-centered care is all about. So I think those are some ways for me to answer that question, Rob.
Right. Thank you. Okay, now looking through here. So, so I have a question then for you, Howard, and this is about kind of the definition of being Asian. So, before you started talking, we had a chance to talk about your children and your three children and your five grandchildren. And so, how do you see as as Asians, as we have kids and they have kids, they're going to be exposed to different lifestyles, different dietary influences from a young age. Genetically, they may even be different as Asians intermarry. So, how do you see the needs of Asian health evolving with generations in the United States?
Great question. So I tend to be very inclusive there. My kids, for example, are so proud of their Korean American heritage. You just can't meet anybody more proud of being part of the AANHPI community than they are. So, some surveys count inclusively people like my own kids. Others don't. I don't understand why it has to be so restrictive. And then if you go through the history of how ethnicities are defined and tracked by the Census Bureau decade in and decade out, and go back into, I think it was late 1700s when the census started. I did this once and then had made some slides for various talks. Every decade since the census started, the way ethnic minorities were defined changed. You never had 2 decades in a row where the definitions were the same. So it just shows how subjective it can be fundamentally. And so if you want a society that celebrates diversity and is inclusive, I would push for having categories where people can self-identify as being part of an HPI background, and having them part of that community. I think it just sends a message of inclusion and welcoming that we all need much more of in our society.
Well, Howard, thank you for your time again tonight. We're running on the end of our time here. It's about 7:30 p.m. here on the West Coast, 10:30 p.m. And so thank you again for spending your evening with us here at Stanford CARE. And on behalf of our organization, we wanted to express our sincere gratitude for your talk tonight and your continuing involvement in all of our efforts here at Stanford. As a brief shout out, I wanted to mention that the Stanford CARE, the inaugural Japanese Health webinar, is scheduled to be held on October 25th at 7 p.m. It will feature Dr. Fumiaki Ikeno, who will present on healthcare innovation in Japan. So we encourage all of you to attend that talk as well. And so without anything further to keep us, I think we're going to adjourn tonight's talk. Thank you again, Howard.
Thank you so much.